with President Catherine Bergeron from Connecticut College, an exciting partnership between Hartford HealthCare and Connecticut College. Today, we are expanding the organization that we created last year, HHC Campus Cares. And the vision behind HHC Campus Cares, the vision is to utilize all the strengths, all the capabilities of the resources across Hartford HealthCare, and to make them available to support the health, the well-being, the safety, the security of our colleges, our campuses across our state. And we're delighted. We have existing partnerships with Trinity College, the University of Hartford, Sacred Heart University, as well as St. Joseph's University. And we've learned a great deal during these partnerships, and we've really learned to appreciate the tremendous opportunities we have to use the resources within Hartford HealthCare to strengthen the capabilities and the support of our colleges and campuses. And our colleges and campuses are essential to our state, to the health, the well-being, the success, the vitality of our region. So anything that we can do in terms of channeling the support within Hartford HealthCare to support the state colleges, universities, is in all of our broader interest. And we do appreciate the fact that they are an economic driver and just critical components of our state. As we talk about this today, I'd like you to think about the fact that what we're speaking about is student health. We're talking about urgent care. We're talking about the athletic programs. We're speaking about sports medicine. We're talking about behavioral health. We're really speaking about, at any moment in time, taking whatever resource we have within Hartford HealthCare, our 3,000 plus physicians, our more than 400 locations, and making those resources available to the students, the faculty, anyone within Connecticut College, and doing it in the most coordinated and efficient manner with the highest level of quality. Also, this is a unique moment. With COVID-19 and what's occurring across the world today, the impact on our colleges and our campuses is enormous. In the sensitivity around infectious disease and how our college campuses need to rework how they operate and how they ensure the safety and protection of everyone on their campuses is very critical. And we look forward to utilizing within this partnership we're announcing all of our resources to help support the college, Connecticut College, as much as possible in this effort. And we will be doing significant efforts around infection prevention and the monitoring of all of the infectious disease and hygienic procedures within Connecticut College, and ensuring that we together are putting best practices forward. So this is an important effort. We really believe that the efforts around HHC Campus Cares, this entity that we created, it's perfectly situated to support our colleges and universities. We also have some very important pending announcements around expanding our capabilities to our prep schools here that are located within Connecticut, and we serve numerous public high schools. So Campus Cares really provides vital services to our secondary, graduate, and postgraduate level education within our region. So with that, we're really excited. We're very grateful to President Catherine Bergeron for her leadership, her vision, and just the proactive strength of conviction around Connecticut College to ensure that they are leveraging all of our capabilities, partnering with us in a way that will undoubtedly provide more strength, more security to all of the families who are part of the broader Connecticut College extended family. So President Bergeron, thank you for your help, and we're really excited to share this announcement with you. We only wish we could be doing it in person and could be having our ceremonial handshake to signify this partnership, but today we're going to do it virtually, but we also look forward to a time when we can be present together, and that will not be hopefully too long into the future.
Well, I feel the same way, Jeff. Thank you so much, and thank you for those remarks, and good morning to everyone who's on this call. I wish we could be here in person as well. We are very proud and excited to be entering into this new partnership with one of the most advanced networks, health networks in the state, and to be able to provide even more comprehensive care to our students at a critical time. We always say that the safety of our students is our highest priority, and I think this new interinstitutional collaboration is a visible sign of that commitment. Our conversation with HHC began about 6 months ago. We saw that they were expanding their presence in southeastern Connecticut, and knowing about the innovations that they were making in the student health space, the Campus Cares program that Jeff just mentioned, we inquired about the possibility of working together. Now, this was, of course, just as the first cases of COVID-19 were being reported in Wuhan, China, and months before the virus would be declared a global pandemic. So we're even more grateful to be announcing this partnership today as we finalize our own plans for our students' return in the fall, and as we invest new resources at the college to mitigate the risks of COVID-19 on our campus. HHC's expertise in the area of infectious disease and population health will be an even greater asset to us in the coming months. So we're excited about the dedicated personnel that HHC will offer to our student health services. We are excited about the expertise that they will bring to sports medicine, and we're excited about the large network of physicians and specialists that will be available to our students through this partnership. Our vision, which I know Jeff shares, is to elevate the level of service and to integrate student health and well-being across the campus. And by doing that, I think we will ensure that our students will have the care and support that they need to be successful, both academically and personally, especially in this coming semester. So this is a happy day for all of us, and I'm really glad to be sharing this news publicly today. It's a long-awaited moment. And I'd like now to introduce Victor Arcelis, our Dean of Students, who was hugely instrumental in securing this new partnership and who I think can speak very directly to its value for our students.
Thank you, President Bergeron. It has been a pleasure to work with the HAC staff over the past 6 months to develop this partnership. Since the very start, I have felt a great deal of alignment in our goals and our approach to student healthcare on campus. Right away, as it relates to the impact that students will see, they will see an increased staffing in student health services with a variety of different roles supporting the work of the health center. In addition, both student health services and sports medicine will have expanded services and access to a dedicated team of medical personnel from HHC on campus, who can in turn call on the larger HHC network whenever necessary to refer patients to local and regional physicians specializing in a wide range of specialties. As for athletes, HHC athletics trainers and physicians are going to work directly with our student athletes before, during, and after practices and games as they prepare for and compete in one of the most competitive Division III conferences in the country, the NESCAC. The athletic trainers will also provide access to the network of orthopedic surgeons, sports medicine physicians, concussion experts, and cardiologists. Sports neurology services will be provided through HHC Neuroscience Institute. And we'll also have access to consultants in sports nutrition, sports psychology, and athletics performance screening. So as we look ahead to this work together, I'm particularly enthusiastic about joining the Campus Care program that's been mentioned earlier in this meeting. Collaboration with other schools in Connecticut that are part of the HAC network are going to provide our staff with the opportunity to discuss protocols, to share expertise, and to talk through situations we're experiencing on our respective campuses, to really expand that sense of team beyond our own campus environment. Another benefit of this new partnership is the integration, even just within our campus, of student health services and sports medicine, and also the relationship between our on-campus care and HHC's Go Health Urgent Care, which is just a couple of miles away from campus. And that's going to help us extend our hours in terms of when our students can receive care. And the work of enhancing these two connections, both on campus and between on campus and off campus, will enhance the continuity of care that our students receive. Most importantly, this partnership with HAC is going to elevate our quality of care on campus at a critically important time as we face this global pandemic. I'm incredibly impressed with the level of support that we've had so far, and just eager to keep thinking creatively about how we move forward. So next, I'd like to turn it over to Dr. Eric Walsh, Medical Director for the Hartford HealthCare's Go Health Urgent Care. Eric?
Thank you. It was a pleasure to be on with all of you. We are so excited. Our new London office, as you mentioned, is just a stone's throw from the campus. Already, we do see some of the students, so we're excited to be able to offer service to even more students. And one of the things that we'll be able to offer, I work very closely with the sports medicine team at Hartford HealthCare. So any after-hours x-rays that might be needed or splinting, things like that, can all be done right there. And of course, all the x-rays will be visible in a very seamless manner across our network for all of our orthopedists or athletic trainers, whoever needs to take a look at them. So that's one awesome thing. We're really looking at the synergy that we'll get around sports medicine because of this. But the other thing is, we offer virtual visits. So we really are looking forward to many of your students be able to just log on from their dorm room and actually receive medical care without even having to go the 2 miles to our center. And of course, they'll get care at any of our 18 centers across the state. But if they need something in person, the nice thing is we can send them into our center there in New London. They can get an x-ray, get blood drawn, what they need to do, so that the care is very seamless again. And of course, when they go back on campus to student health, all that's happened in our urgent care, it's all the same EMR system, so all of their medical records would be available to them when they go back on campus and see one of the providers on campus, and that was making it so that there's a really nice closed loop approach, very strong continuity of care, the ability to reach out to our providers. And again, we are open 365 days a year. And we are open after hours as well, so it will expand the time when students who sometimes have pretty hectic schedules are able to get in and be seen if they have a need.
Eric, I want to thank you, Dr. Walsh, and particularly I want to thank the president and the dean. We at Hartford HealthCare, we're all in. We are fully committed to this partnership with Connecticut College. We believe very deeply that HHC Campus Cares provides a vital service. Our colleges and universities, they're coveted. These are historic institutions, as are the components of Hartford HealthCare, and how we can merge our capabilities together with the interests, the needs of the college campuses is a tremendous opportunity. But I'm a parent of an incoming freshman who'll be going to university this fall, and I can tell you, people rightfully have sensitivities and concerns as they leave their children to different campuses. And we're going to do everything possible within our system to support Connecticut College so that people have safety and security and trust, that the resources are there 24 hours a day, 7 days a week. And it ranges from our helicopters to our urgent care centers and everything in between. But the full capabilities of our system are now part of Connecticut College and will be available and integrated. And we're just very pleased, again, with the president and the dean's commitment to doing this on campus, and we will be their partner to support them with all the resources they need in whatever types of circumstances ultimately we have to work through. So we're all collectively happy to answer any questions we can that you have today. But this is a wonderful partnership, and we have enormous respect for Connecticut College, its importance to Connecticut, and we're delighted to now be a partner in supporting it.
We're delighted too. And I must say that our Board of Trustees was thrilled to hear this news.
Thank you. Questions, comments for any of the participants?
Yes, a question for Catherine Bergeron. It's Frankie Graziano from Connecticut Public Radio. You mentioned something about plans finalized or at least being finalized for the upcoming semester. What can you tell us about when students may return on campus?
Our current plan is for the students to return on August 24th for the first day of classes. We have been at work daily for the last 2 months, and determining how we do that best in order to maintain the health and safety of our students and our workforce. And that involves then some very innovative ways that the faculty will be delivering classes both on campus, remotely, and in hybrid formats over both 7 and 15-week terms. So there's a lot of work. Faculty are right now doing a lot of their own preparation to be prepared for delivering instruction in some new and innovative ways that will preserve the excellence that Connecticut College is known for.
It's Frankie again. Can you just provide any examples of the kind of things you're doing to return students to school, cleanliness, things of that nature?
Oh, yes. Well, all of the classrooms are being considered redesigned. We're actually partnering with an architectural firm to determine how we should best use space so that there's enough air volume and a lack of density in the classrooms. We're opening up new spaces for teaching that will be available. We are redoubling our efforts for cleanliness in the residence halls, and we have a new plan for the way students will be using some of the facilities in the residence halls to preserve their own safety and security. And I could allow Dean of Students, Victor Arcelis, to say a little bit more about that if you'd like to hear.
Sure. So we are making adjustments to how we house students. We aren't we're de-densifying spaces, so we won't be having triples and quads. We're going to be housing students in peer groups, enabling them to be closer to friends, not having to go into other residence halls because they're going to be restricted to just their residence hall. Collaborating across campus with facility staff, dining staff, really redesigning the whole student experience in a way that supports social distancing, while at the same time creating opportunities for students to gather and to connect with each other in ways that are still part of what it means to be residentially on a campus, but doing it in a safe way.
And I guess I should also mention that we have plans for a fairly aggressive testing regime for all students and faculty and staff who are facing students on a regular basis. And so this will go beyond the recommendations from the state, and we're really grateful to have HHC as a partner in this as we seek to maintain the health of the campus.
Any other questions? Very good. Again, we thank you.
It's Frankie Graziano from Connecticut Public Radio again. Since nobody else is going to ask any questions, I'll ask one. Any idea regarding this monitoring infectious diseases? I understand that you just said, President Bergeron, about fairly aggressive testing. Will Hartford HealthCare help with that testing? Just give an idea of how maybe the network can help you mitigate the spread of COVID-19 on campus.
Yeah, well, I'm going to let Victor take the details. The plan right now is for us to teach students how to test themselves and to do that on a basis that is something like twice a week. And yes, Hartford Health will help with that. Victor.
Hartford Health is going to be working with us on establishing all of our protocols. In fact, I have a meeting later this week with one of their infectious disease experts and thinking through all of the strategies that we will put in place as it relates to what happens when we identify, a student, staff member, a faculty member who tests positive for COVID, and all the steps that will kind of proceed after that. Obviously, as a student is placed in isolation and will be cared for by the Hartford HealthCare staff and working with us in strategizing all of our work, with isolation as well as with quarantine. As far as testing, we are looking at a twice-a-week regimen of testing that will be done in partnership with the Broad Institute. And the results of those tests and the work that's happening with our students relating to that testing will then be transferred over to Hartford Health in terms of the care of those students.
Very well. We'll
Your
get
name, please, for the record.
My name, Victor Arcellus, senior student.
terrific. Again, we thank everyone for joining us this morning. This is a wonderful partnership. It's going to be a wonderful advancement for Connecticut, for Hartford HealthCare, for Connecticut College, for our region, and we look forward to being on campus at Connecticut College, to that beautiful campus, in person, all together as soon as possible. So thank you again. Thanks so much.
Thank you so much.
Thank you, guys.
Thank you.